Good day everyone, I am Mary Jane Ardillas. This video is all about essential concept of special education. I am here to give my reflection about 14 categories of students with disabilities under IDEA or Individual with Disabilities Education Act and some strategies that we can use to deal with this kind of students. Let's start with intellectual disability. Children with an IQ below 70, they have difficulties in comprehension and life function, and also a person has certain limitation in cognitive functioning and skills including communications, social, and self-care skills. Strategies: teach self-monitoring techniques. Have students work each step in an assignments in different colors. Deaf blindness. Child with both hearing and visual disabilities evident before age 3 that affects a person's ability to communicate, access information, and get around. Strategies. Teachers should use large print textbooks, braille sign language, tactile, modeling, mutual tactile attention, and the use of an hand-under-hand approach to interaction. Deafness, an ability to comprehend verbal language due to a lack of hearing ability. Deafness students have a hearing loss in speech and loudness greater than 90 decibels. Strategies: provide written materials to supplement all lectures, tutorials, and laboratory sessions. And announcements made regarding class times, activities, field work, industry, visit, etc. should be given in writing as well as verbally. Development delay are defined children that age 3 through 9 with a developmental delay in physical, cognitive, social, emotional, or adaptive development. Children are often early intervention services for their specific needs. Strategies: build student motivations, use strategies to make directions and learning expectations clearly. Other health impairments includes a range of conditions such as limited strength, vitality, or alertness due to acute health problems. Strategies: teach the students strategies to stay organized. Teachers should allow students extra time to complete activities. Emotional disturbed students that are unable to learn due to continuous behavior problems. These students may be bipolar, depressed, anxious, and have psychological problems as well. Strategies: teachers should allow keep class rules activities simple and clear. Teacher use motivational strategies. Speech language impairment. These students define a communication disorder such as stuttering, impaired articulation and language, or voice impairment. These students have trouble communicating, doing class presentation, and participating. Strategies: be near the students when giving instructions and ask the students to repeat the instructions and prompt when necessary. Teacher should be provide a quiet spot for the student to work if possible. Traumatic brain injury, acquired injury to the brain caused by an external physical force resulting in total or partial functional disability. Students that have memory difficulties and concentration problems. Strategies: provide ample time for task completions. Students with traumatic brain injuries often need extra time to process information and complete tasks as well as to respond to verbal cues and instructor questions. Orthopedic impairment is severe impairment of the bones or muscles that adversely affect a child's educational performance. Students suffer severe burns, deformations, bones abnormalities, and distortions. Strategies. Special seating arrangement to develop useful posture and movement. Instructions focus on the development of the gross and fine motor skills. Visual impairment. The disabilities define an impairment in vision, even with corrections that adverse affects a child's educational performance. Students will have difficulties reading, utilizing technology, and have a range of eye conditions. The strategies, teacher should give clear instructions as the student may misinterpret gestures and facial expressions. Um, Teacher use the student's name when seeking his or her attention. Multiple disabilities, simultaneous impairments such as intellectual disability and blindness occurring at the same time. These students often need care throughout their entire life. Some have difficulties breathing, reading, and seeing. These strategies, teachers should be explain and describe ideas with many details. Provide exposure to a wide variety of literacy materials using real objects and adaptations to make them as accessible as possible to an individual students. Hearing impairment. This is an impairment in hearing, whether permanent or fluctuating. The students that have trouble with vocabulary, grammar, listening to lecture, and participating. The strategies, teacher should be use captions. Teacher can use visual stimuli such as providing lesson outline. And then the last is the autism, a developmental disability that characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communications. The strategies avoid sensory overload. Students with autism can be distracted by unexpected things in their environment, such as bright lights, smells, and sounds. Be predictable. An established routine on a set schedule helps autistic students feel less anxious in the classroom.